In this video, I'm going to talk about some basic concepts and terminology that are specific to the spinal column. And when I say spinal column, I'm talking about the neck, the mid-back, and the low back. So at the spine, there's 3 degrees of freedom, 3 different types of movements in the 3 planes. There's flexion and extension. There's rotation, okay, and the flexion and extension occurs in the sagittal plane around a medial-lateral axis. The rotation occurs in the transverse plane, whether it's at the lower spine or at the neck, around a vertical axis. And then there's what we call lateral flexion, which is a movement in the frontal plane. Okay, and by convention, it's lateral flexion, whichever direction you're going. So that brings me to some terminology that's kind of specific to the spine, and that's that we normally use the terms medial and lateral frequently when we're talking about the appendicular skeleton or the extremities to refer to positions, but that medial and lateral are terms that relate to the midline, and the spine is the midline, so those terms are not really very useful. So when we talk about the spine, we will talk about right and left. So for example, for lateral flexion, that you're moving to the right or you're moving to the left. Also with rotation, you can talk about rotating to the right or rotating to the left. Also with rotation, sometimes people use the terms clockwise and counterclockwise. So especially with the pelvis, if you can imagine yourself in terms of a clock, so that 12 o'clock is here, 3 o'clock is here, 9 o'clock is here, and you can imagine your anterior superior iliac spines, kind of the hard little parts, the top of your pelvis. So you can rotate clockwise or counterclockwise. Either one is acceptable. Sometimes the clockwise, counterclockwise terminology is a bit easier to use than right and left. And so then there's also 2 movements that are somewhat specific to the spinal column. One is at the neck, protraction and retraction. Protraction is this, and retraction is this. It's a movement in the sagittal plane. Protraction is actually extension in the upper spine, okay, and it's flexion in the lower spine. And then retraction is going to be the opposite. It's flexion up here in the upper spine, and it's extension in the lower spine, and in the lower cervical spine. And again, that's a movement in the sagittal plane. We also talk about anterior and posterior tilt. That's a movement of the pelvis. It's in the sagittal plane. It's similar to flexion and extension, but it's just the pelvis moving. So this is a pelvis with 2 femurs attached. All right, so anterior tilt is going to be the pelvis kind of rotating forward. Okay, if you can imagine your anterior superior iliac spines, okay, right there, they're kind of moving forward in an anterior tilt. In a posterior tilt, they're kind of moving backwards. Okay, so again, it's a movement in a sagittal plane. It's kind of like flexion or extension, but it's just the pelvis moving. So note that when you do an anterior tilt, when that pelvis rolls forward, from a muscle perspective, that could be from a muscle pulling down on the anterior side, or it could pull up on the posterior side. For a posterior tilt, it's going to be the opposite. You could have a pull down from the posterior side, or you could have a pull up from the anterior side. And the way that looks in real life, okay, so right now I'm kind of in a neutral. If I go anterior tilt is like that, and notice that I've got a greater curve in my back when I do that. When I do a posterior tilt, I'm going back, and notice that my back is more flat, okay? So anterior tilt, posterior tilt. And that's a movement and terminology of the spine.